On to an interview of the evening. Joining us now live in the studio, Dr. Michael Ayabe. He's the head of disaster management at the Red Cross. Welcome, Doctor. Good to see you.
Thank you.
You guys aren't managing disaster very well, are you, at disaster management? I
think we are trying to do our best, except that you can see the situation that we're dealing with this time round. Has not been this before. This is, you know, if you look at the previous heavy rains that we've had to deal with in terms of floods, we've never had this. You know, today I'll tell you, with our search and rescue teams have rescued over 1,900 people from various places. Today alone, we've rescued about 51 using light boats, and you're using what was actually a road to move through using a light boat, and that is supposed to be a road. So you can imagine we've not had these situations. Yeah. Previously, of course, we've been trying to move people along the Tana River, and we would move along the river as you get them across. But this time round, it is the roads that have become the rivers. So this is something that does not have precedence. So
what are the latest figures now in terms of deaths and displacements?
I think I would say over the weekend we haven't done the tallying yet, but for sure you look at what has happened over the last 2 days, would put it at about over 40,000 people who have been now displaced and are in need of shelter. And that means also contamination of water. You've seen the various bridges that are now cut off. And even in our interventions, part of our interventions is normally cash. But you see, with commodities not being able to move, that would not be able to work. So people need assistance in kind, and so beside the search and rescue efforts that have to continue, we would need physical food, water treatment, health commodities to be taken to those people. And then there are no roads. So this would mean lifting from one place to the other. And you can imagine when you have to move food by air to support people who are marooned, it's not easy. And now major roads that we have, especially in the northeastern, have been cut off.
Doctor, you described earlier on, you said you've never seen anything like this.
Indeed.
When you get there, I mean, describe for people who are not in those zones. We see the pictures, we've seen the videos. Describe for us how bad it is.
Well, just to put it simply, if you're staying in Nairobi, we've had, you know, cases where we have floods and then the furniture in the house just get wet, and then after some hours the water will of course move out, and then we start with the cleaning, the messes, a few electronics lost. But what we are dealing with in these areas that are adversely affected in the coast and northeastern is such that the levels of water have gone to the lintel. Barely are you able to see roofs, especially for buildings that are short. So the challenge now would be, how would this person survive even if they are able to just get out of the house and they don't know how to swim? And you can imagine with young children, the kind of small animals that we have, shoats. So all this cannot be rescued, you know. And so you can see the effort that is being made is to ensure that we can save the lives. Other items you would say would come later. Now, once you move this person, they have nothing actually that they've carried with them. They don't have shelter, they don't have food, they don't have any clothing, warm clothing for them. You can imagine people have just to walk through that dirty water, and that is the only pair of clothes they have. Yeah. So get to the other end, you're wet, and the rains are continuing. So this is the situation. Look at what you saw in Mombasa. So just houses get full and people have to swim out to be able to be safe. That is the situation we're talking about even in Garissa as we speak. So farmers have been marooned in their farms. They are normally a bit higher. And farms are normally fairly safe because then they do irrigation, you know, pumping water. Now the whole place is just submerged. So it is dire. And look, even our teams that are working in areas around the dam, moving from Garissa to that place is not possible, and therefore these people will soon run out of supplies all over. So that is the risk. You know, you can imagine how life will be if you can't be able to get medics, you can't be able to get food locally. It is really, it's bad, and we are just hoping that probably with these rains continuing, it will give us even a small window to be able to move a few supplies.
You talked about a small window to move supplies. It's already a very dangerous situation to reach the people who have been, you mentioned, marooned. They've been isolated due to the floods. How are your teams, are they able to even get to them? Have they managed at least those areas that you've talked about? Days have not seen people, have not seen aid or any kind of food.
We have tried. At least there were a few supplies that had been strategically positioned, but we did not look at this kind of numbers. Yeah. The estimates were it would be moderate, but the numbers have gone up, and so whatever was there is what is being used. We've mobilized use of light boats, and these are the ones now that are able to move. So, for example, you have a team that probably is based in Garissa. They have several boats, so they are able to move into places that have, high level of water. To go and rescue these people. So just another group also in Garissa have a boat, and they are able to do that. So our volunteers and staff in the field are the ones who are doing this great job. And if you look at some of the images shared in social media, you will see them getting out there. The only message I want to share with the members of public is, once they are rescued, even if they see that probably the water levels in any way go down, they should not go back until it is safe. Because we have had situation where people who were rescued about 2 weeks ago, brought to safe ground, somehow made their way back to the farms, and we've had to really go back for them, because we can't allow to lose any life.
Dr. Real quick, there is a national disaster team in place, isn't there? Are you coordinating with them? Are you working together?
Sure. We have been working quite closely with them, and I would say the efforts, especially by the KDF, who have been helping us to airlift this food, because where the food has been in major towns, the places most affected are rural, and you can't move these people out. So the government's machinery, especially the KDF, has been helping in hoping this food, moving it from from the warehouses and dropping it to the villages that are in need, where now our volunteers and the leadership in that area are able to do the distribution. And I think based on the directions by the president, that I think there is an expansion now of that coordinating mechanism. I think we should be able to do better, and even be able to reach many more people as per need.
Before we let you go, Dr. Michael, for the first time, actually, this week, we saw the IFRC finally put a figure to how much response will cost. 18 million francs, which is the equivalent of 3.1 billion shillings, right? So where is that money going to go in terms of the response?
This would go to a number of areas. One would be to support purchase and distribution of food. We have, of course, these search and rescue efforts that will go on. Part of it might require aircraft supports. We need lots of non-food items, especially for shelter. As you can see, all of the places now that have been displaced, they need shelter material. They would need cooking items. So this shelter is normally a kit, and these will now be bought and be taken to those people, as the forecast indicating that this is likely to stay with us for a while, and that is how they break down, including health surge teams that will now have to be deployed. Likelihood of disease outbreaks, cholera, for example, and other waterborne diseases, malaria, you can see, always very much associated with lots of rain. So all these holistically has been calculated to be able to cover those costs.
Dr. Michael Aebe, thanks so much for your time. We appreciate it, and good luck with your